Hello, everyone. Good morning, good afternoon, good evening, depending in which part of the world you are. This is Dr. One presenting fibroids. I have heard so many questions with regards to fibroids. First of all, I am not a gynecologist. So I just want to give you the basic guides on how to go about it. When it comes to physical assessment, you will have to see a gynecologist for things to be done properly. What are we talking about here? Uterine fibroids are common growth of the uterus. They often appear during the years you are usually able to get pregnant and give birth. So I would say from the age of 18. It's rare, 18 honestly, but it can happen. Uterine fibroids are not cancer, so get it clear. And they almost never turn into cancer. So just wipe it out of your head that it is not cancerogenic or whatsoever thing you want to believe to be. They aren't linked with a higher risk of other types of cancer in the uterus either. They are also called leiomyomas or myomas. Fibroids vary in numbers and sizes. You can have a single fibroid or more than one. Some of these growths are too small to see with the eyes. Others can grow to the size of a grapefruit or larger. A fibroid that gets very big can distort the inside and the outside of the uterus. In extreme cases, some fibroids grow large enough to fill the pelvic or stomach area. They can make the person look pregnant. Many people have uterine fibroids sometime during their life, but you might not know you have them because they often cause no symptoms most of the time. Your healthcare professional may just happen to find fibroids during a pelvic exams or pregnancy ultrasound. What are the common symptoms? Many people have uterine fibroids, don't have any symptom. In those who do, symptoms can be influenced by the location, size, and number of fibroids. The most common symptoms of uterine fibroids include heavy menstrual bleeding or painful periods, larger or more frequent period, pelvic pressure or pain, frequent urination or trouble urinating, growing stomach area, constipation, pain in the stomach area or lower back, or pain during sex. Now, if you are having all these symptoms, I would say you see a medical doctor, precisely a gynecologist, to make sure that you are not suffering from this condition. Now, let's see what could be the causes. The exact cause of uterine fibroid isn't clear, but these factors may play a role. Gene changes. Many fibroids contain changes in genes that differ from those in typical uterine muscle cells. Hormonal changes. Two hormones called estrogen and progesterone cause the tissue that lines the inside of the uterus to thicken during each menstrual cycle to prepare for pregnancy. These hormones also seem to help fibroid growth. Fibroids contain more cells that estrogen and progesterone bind to than to do typical uterine muscle cells. Fibroids tend to shrink after menopause due to a drop in hormonal levels. Other growth factors could be substances that help the body maintain tissues such as insulin-like growth factor may affect fibroid growth. Then we have the last one, extracellular matrix. These material make cells stick together like mortar between bricks. The extracellular matrix is increased in fibroids and make them fibrous. The extracellular matrix also stores growth factor and causes biologic changes in the cells themselves. Now, let's look at the risk factor. There are few non-risk factors for uterine fibroids other than being a person of reproductive age. These include race, family history, and other factors. So let's look at the race. All people of reproductive age who were born female could develop fibroids, but black people are more likely to have fibroids than people of other racial groups. Black people have fibroids at younger ages than do white people. They are also likely to have more or larger fibroids along with worse symptoms than do white people. With regards to family history, if your mother or sister had fibroids, you are at higher risk of getting them. So take this one clear. Make sure you find out from your mom and your siblings if they have had this condition. Other factors: starting your period before the age of 10, obesity, being low on vitamin D. To be more precise, I would say your vitamin D3 value. That's what they are saying here. Having a diet higher in red meat and lower in green vegetable. Fruits, dairy, and drinking alcohol, including beer, seem to raise your risk of getting fibroid. So this is another key point that we need to be very careful here, because I will call it lifestyle. Your lifestyle matters a lot when it comes to this medical condition. So for those of you in Africa or wherever you are, I would suggest, if you really want to eat meat, then make sure it is the bush meat and dry. Otherwise, I would tell you, don't even get yourself involved in meat. Go with green, leafy vegetable. Dairy product, I would say no. Try to reduce it as much as you can. So those are some things that you need to pay more attention to. Green leafy vegetable are highly loaded with nitric oxide, so it helps in avoiding this medical condition. Now let's look at the complication. Uterine fibroids often aren't dangerous, but they can cause pain and they may lead to complications. These include a drop in red blood cells called anemia. That condition can cause fatigue from heavy blood loss. If you bleed heavily during your period, your doctor may tell you to take an iron supplement to prevent or help manage anemia. Sometimes a person with anemia needs to receive blood from a donor, called a transfusion, due to blood loss. Now, there's another condition that fibroids also can occur. I will call it pregnancy. So we'll look at now pregnancy and fibroids. Often fibroids don't interfere with getting pregnant, but some fibroids, especially the submucosal kind, could cause infertility or pregnancy loss. Fibroids also may increase the risk of certain pregnancy complications. These include placental abruption, when the organ that brings oxygen and nutrients to the baby, called the placenta, separates from the inner wall of the uterus. Another factor is fetal growth restriction, when an unborn baby doesn't grow as well as expected. And the last one, preterm delivery, when a baby is born too early, before the 37th week of pregnancy. Can fibroids be prevented? I will say yes. And let's see. Research continues to study the causes of fibroid tumor. More research is needed on how to prevent them, though it may not be possible to prevent uterine fibroids, but only a small percentage of these tumors need treatment. You might be able to lower your fibroid risk with healthy life changes. So here I would tell you, be careful with stress. So the first thing is stress. Your weight is another key thing. Your body mass index is another. Those are all the factors. So if you are slim in structure, then that's fine. But as you are putting on weight, you are at high risk. Try to stay at a healthy weight. Get regular exercise and eat a balanced diet with plenty of fruits and vegetables. Some research suggests that birth control pills or long-acting progestin-only contraceptives may lower the risk of fibroids, but using birth control pills before the age of 16 may be linked with high risk. So those are the information that I can say for now, and I'm going to make part 2 of this video for you to know what to eat and what not to eat. So again, I'm going to make the part 2 now. Part 2 will be specifically on activity and what to eat and what not to eat. Thank you so much, and please subscribe to my YouTube channel, like it, and ask more questions, and I'm here to help you. I am Dr. WAN. Thank you, and bye-bye.